Mr. Speaker, I rise today because Donald Trump and congressional Republicans are once again waging war on our healthcare system. Their big ugly bill restricts access to federal student loans for advanced degrees, including in high-demand healthcare sectors like nursing, physical and occupational therapy, social work, and so many more. When I went to school to become an occupational therapist, I had to take out loans. I remember filling out those forms, hoping I'd have enough to cover tuition, books, and other expenses. The weight of those payments followed me for years. I took on that debt because I wanted to build a better future for my family and because I wanted to help people as a healthcare practitioner. This administration wants to force aspiring healthcare professionals to mortgage their futures before they treat their first patient. Worse, this move will deter them from answering their calling, taking an axe to the very system that trains them. Because of the Republican healthcare crisis, our hospitals are understaffed, clinics are closing, and rural communities are being left behind. Our nurses are burning out, therapists are stretched thin, and practitioners are retiring faster than we can replace them. Every healthcare system in America is screaming code blue, warning us that the future of our workforce is flatlining before our very eyes. This means fewer nurses at the bedside, fewer therapists helping patients recover, fewer specialists serving rural communities, and fewer mental health providers at a time when this nation is desperate for them. It means Americans are waiting longer for care as hospitals operate with skeleton staffing. It means communities are growing sicker, all because this Congress, under Republican control, decided that access to advanced healthcare education is a privilege for the few, rather than a pathway to service for all. This is a callous assault on the very people who hold this nation together. Every prospective student who dreams of helping people in healthcare. This misguided policy, which caps graduate student loan borrowing for certain advanced health degrees, means these students will be permitted to borrow only half as much in federal loans compared to their counterparts. Not only will healthcare professionals be impacted, but teachers, architects, accountants, engineers, and many other professionals who will lose the ability to finance their education through reliable, flexible federal loans, pushing them instead into the arms of predatory private lenders and adding to the mountain of debt our students already endure. The Bureau of Labor Statistics says that we need to fill nearly 200,000 nursing positions every year through 2033 just to keep pace. The United States also needs tens of thousands of new mental health professionals and rehabilitation providers annually. Cutting off our healthcare system's talent pipeline also is not just cruel, but it's short-sighted, and it will drive up the cost of healthcare. It is reckless, and it further strains a healthcare system already in crisis. Gutting the healthcare workforce will shrink the care economy, and it will stifle job growth at a time when families are desperate for getting control of their lives and ensuring that they can afford their daily cost of living. Under this thoughtless Republican rule, if you want to save lives, prepare to drown in debt. If you want to do a job this nation needs, prepare to pay a steep price for it. If you want to look after the sick, don't expect your government to look after you. In the richest country in the world, Trump and congressional Republicans are saddling an already overburdened healthcare workforce with an even more unimaginable financial burden. But the American people know better. They remember the nurse who sat with their parents in hospice, the physical therapist who got them back on their feet, and the social worker who helped their family get the support that they needed. They know that healthcare workers aren't to be taken for granted or pushed aside. And they know that Donald Trump and congressional Republicans have failed them once again. As the only occupational therapist in Congress, I will not sit idly by while Trump and congressional Republicans sabotage the very workforce that keeps this nation alive. House Democrats will continue to fight like hell to protect every student, every patient, and every community that Washington Republicans are abandoning. I yield back.
The chair will